So what about the future? There'll certainly be new drugs that will, as we better understand how the brain manages to both inhibit and excite, drugs that help make medicine more personalized and better quality sexual medicine drug. There's no question that that's going to happen. And that's why I'm emphasizing within the sexual tipping point model the necessity of having an integrated approach. Here, I'm just offering an example of a desire disorder secondary to both vulvodynia and erectile dysfunction, which is a case I'll talk about a little bit later. But there's going to be unknown physical causes that can have a negative effect. You want to be able to provide counseling. I've got a picture of the sort of hand of God coming down because we all could use a little bit of blessing and luck in order to be able to accomplish what we're trying to do. But really what I want to emphasize is the importance of a transdisciplinary approach. And by that, quoting Rosenfeld here, we're talking about a collaboration in which exchanging information, altering discipline-specific approaches, sharing resources, and integrating disciplines achieves a common scientific goal. So I really had the privilege in the 1990s and the early 2000s of being able to consult to some of the pharma companies on the development of their drugs. And for these medical advisory groups that we had, like that one that I mentioned with Jim Faust, we had people from all different professions and disciplines. And we would present to each other from our own specialty so that, and exchange our PowerPoint slides. So certainly by the end of a few years of those meetings that tended to include many of the same people internationally, you really began to get a sense of what is the relevance of cardiology to this, both the medications for heart disease as well as some of the underlying conditions. How does that impact sexuality? Same thing with neurology, endocrinology, gynecology, urology, and of course, psychology.